Welcome back to the channel. Hope you have a good weekend. Let's start today's class. Okay, today we'll be discussing in very brief about sinus lift. Like you should have a knowledge what it mainly it is considered an implant or deltoid implant, but we'll study little bit because we are studying maxillary sinus. So we'll study little bit about sinus lift. Okay, let's start. Sinus lift. It is also known as maxillary floor augmentation process, sinus graft process, sinus augmentation or sinus procedure. Okay, maxillary floor augmentation, sinus graft, sinus augmentation or sinus procedure. The maxillary sinus lift grafting procedure was designed and described by Boyne and James. It is a surgical procedure which aims to increase the amount of bone in the edentulous posterior maxilla. Okay, it is mainly done to increase the amount of bone in edentulous posterior maxilla. Okay, what are the indications? If there is inadequate bone volume and vertical height, inadequate bone volume and inadequate vertical height between the floor of the sinus and the edentulous disc. So it is overcome by this process. Now, if we have to place an implant in maxilla that have suffered severe bone loss due to sinus pneumatization. In case of sinus pneumatization, we use sinus lift procedure to achieve primary stability for long-term success. In cases where there is strong occlusal forces. Okay, these are the indications of sinus lift. Now, what are the approaches? Two main approaches. First is direct technique. Second is indirect technique. Okay. What is direct technique? It is also known as external lateral window approach. External lateral window approach. And there is indirect technique, which is also known as internal transalveolar approach. Okay. Direct technique and indirect technique. Direct technique, the sinus membrane is directly visualized and when there is more than 4 to 5 mm of bone grafting is required. Now, indirect technique. Concept is to create an intentional green streak fracture by hand tapping force in vertical direction. Okay. It was first performed by Tatum. It is also known as Summers osteotome sinus floor elevation, bone added elevation, or antral membrane balloon elevation or dilatation. These are all different kinds of indirect technique. Okay, indirect technique में ये सारे आते हैं. Osteotome sinus floor elevation, bone added elevation and antral membrane balloon elevation or dilatation. Okay. Now coming to direct technique steps. Firstly, anesthesia. Incision, that is full thickness flap we raise, then lateral window or antrostomy is done, then sinus membrane elevation, preparation of the implant site, graft placement, membrane placement and suturing closure. Okay, I am discussing in very brief, okay, just the steps and what it is actually and what are the different process and how we will proceed to it. Now, what is the advantage? Advantage is easy access. Now, what are the disadvantages of direct technique? Disadvantages is more pain, it is time consuming, more post-operative discomfort, okay, needs highly efficient surgeon and more susceptible for infection. It is time consuming and it is more susceptible for infection. Okay, this is all for direct technique. We have known that it is also known as external lateral window approach and that sinus membrane is directly visualized and when there is 4 to 5 mm of bone grafting is required, we do direct technique. Okay, then there is indirect technique which has many types like Summers osteotome sinus floor elevation, bone added elevation and antral membrane balloon elevation or dilatation. So we will discussing Summers osteotome sinus elevation steps of indirect technique and its advantages and disadvantages in next class. Till then, like, share and subscribe. Bye.